my name is Madeline. I'm a student nurse from Purdue University Northwest, and I'm going to be assisting your nurse that's on staff here at the hospital today. So I'm just going to verify that I have the right patient by seeing your name tag to verify your name and date of birth. Okay, and I see that you're not wearing the allergy band. Are you allergic to anything that you know, whether it be food, environment, medications, or even seasonal allergies? Okay, great. So I already have my necessary equipment here. I've performed hand hygiene before I entered the room. Now that I've identified my patient, we can begin. So I already have my curtains closed in here. All of the doors are closed as well to ensure that you have privacy. And the reason that we're doing this tracheostomy care today is just to ensure that you have an open airway, to make sure that you're getting oxygen properly to your lungs. So if you're feeling any pain throughout this, just feel free to let me know. And if you are, I will go ahead and administer some pain medication, if indicated in your chart as well, and then we can go from there. So now that the bed is at a comfortable working position, it's elbow height, and you're in semi-follower's position, which is where I need you to be. You're also conscious, so you're going to be facing me, which is great. So my bedside table is right here to my right, so it's right in hand reach. And my trash receptacle is right by my feet here, so I can easily dispose of the equipment that we already used. So now I'm going to put on my personal protective equipment. So I'm going to be putting on my mask here. And this is just to ensure that even if there was some splatter, it wouldn't get into my mouth or anything like that. And I have my gloves, or not my gloves, my goggles. Okay, so now I'm going to suction the tracheostomy. And it hasn't been suctioned recently, so that's why it needed to be suctioned. So now I am going to carefully open a package with a new disposable inner cannula, and I'm going to make sure that I'm not contaminating this in any way, shape, or form. I'm also going to open some cotton-tipped applicators over here, making sure that I'm not contaminating them in any way, shape, or form. I also have a sterile cup with 0.5 milliliters, well actually 0.5 inches of saline in it, and this is also within reach at the work surface. So now I'm going to put on my disposable gloves. Okay, so now what I'm going to do, so I'm going to remove the oxygen source because there is one present. I'm going to stabilize the outer cannula and the faceplate with the tracheostomy with my non-dominant hand. I'm going to grasp the locking mechanism of the inner cannula with my dominant hand. I'm going to press the tabs and release the lock. So I'm going to gently remove the inner cannula and place it in the disposable bag here. So the site dressing was already placed in the trash. So now I'm going to discard these gloves here, and I'm going to put on some sterile gloves. This is my sterile field right here, making sure that I'm not touching it. And then I need to swoop with this other glove here. Also over my sterile field, making sure that I'm not touching it. Okay, now I can adjust this glove. Okay, so now I'm going to pick up my new inner cannula with my dominant hand here, and I'm going to stabilize the placement with my non-dominant hand. I'm going to gently insert the new inner cannula into the outer cannula, and I'm going to press the tab to allow it to lock to the outer cannula and reapply the oxygen source here because he did have one. So now once again I'm going to remove the oxygen source if necessary. I have a cotton-tipped applicator. And I'm going to dip it in some sterile saline and clean around the stoma of the faceplate here. So I'm only using one each time just because that's the sterile way to do it. After this, I'm going to pat the skin gently with a 4x4 gauze pad. And I'm going to slide a commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the faceplate there. Now I'm going to change the tracheostomy holder. And so this is my second nurse right here. She's going to help me out with the old collar. So one nurse is just going to hold the faceplate here. And then I'm going to open the package for the new tracheostomy collar. So we both have on clean gloves. So with this one nurse is holding the faceplate, and now I'm pulling up the Velcro straps and gently removing the collar. So this nurse here is holding the faceplate the entire time. So now I'm going to place the collar around the patient's neck and insert the first one tab, then the other, and then into the openings of the faceplate, which would secure the Velcro straps on the tracheostomy holder. After this, I'm going to make sure that the collar is comfortable for the patient, making sure that I can fit one finger under the neck and the collar, and make sure also that the patient voiced that it is comfortable for them if they can. So I'm going to reapply the oxygen source here. I'm going to remove my gloves. I'm going to remove my goggles from the side. I'm going to remove my mask. I'm going to take the bottom off first to make sure that nothing falls down. So I remove my mask. Okay, well that wasn't sterile, but I will just remove my gown like that. So I did tie it in the back like I normally do. Okay, so now I'm going to check the patient's respiratory status, making sure that they're comfortable with everything. I'm making sure that their respiratory rate is where it needs to be. And then once I have left the room, I'm going to perform hand hygiene. And that is the end of skill 38.5.